In this video, I want to tell you what you need to know before getting otoplasty. Are you thinking of getting otoplasty surgery? Well, my name is Sagar Patel and I perform hundreds of otoplasty surgeons every year. I've searched the country to find other surgeons who do it as much as I do, and I just simply can't find anyone. I started doing this surgery right out of practice. I had no idea it would be my passion, and over the years, it's not only grown from something I love doing, but something that I'm famous for doing. Otoplasty is a simple surgery. We can do this on patients as young as 6 years old, and I've done this on patients as old as someone in their late 70s. It's a surgery where we're folding, bending, and manipulating your ear cartilage to get your ears closer to your head. We're not making them smaller, rather we're just repositioning them. Whenever we do otoplasty, I tell people that we're not doing this because there's something wrong with your ears. Quite the opposite and something meaner. We're doing this because there's something wrong in your head. There's no such thing as pretty ears, and what we're trying to do is make them less noticeable and make you think less about your ears. So when I ask someone what the goal is for surgery, for me, the goal is that they're driving about 6 months later and they don't remember the last time they thought about their ears. Now, the surgery is a lot more complicated than most surgeons put it out to be. And I think we all need some background to understand the dangers of this surgery. The background is that whether you're a plastic surgeon or a facial plastic surgeon, otoplasty is what you're tested on. There's questions on your board exams, and every surgeon, while we love doing the surgery, is not an expert in the surgery. In fact, that's where I've learned very, very few are. The average surgeon probably does 2 to 5 per a year. In general, that's about how much I do per week. And I'm not saying I'm better than anyone, I'm just more experienced at this point. I've done this surgery a lot more and learned a lot of lessons, unfortunately, the hard way. The aesthetic goals of otoplasty are very simple and important, but in general, when people are doing the surgery and when we're even learning from the textbooks, we're learning techniques, not aesthetic outcomes. Those techniques, while useful, aren't all inclusive, and you can't apply the same surgery to every single person and get the same results. While there are some patients who can do great with how their ears start, there's others where their ears have significant abnormalities away from the way surgeons are taught, and they're getting themselves into trouble. So the first thing you want to do when you're talking to a surgeon about otoplasty is ask to see before and afters. The average surgeon will show you just a couple of the same patient, and in fact, some of them might even be close to right after surgery. Make sure there is tens to hundreds of results if you want to be confident in your surgery. Fixing this surgery, especially if it's overpinned, is extremely difficult, and so this is not a surgery you want to do twice. That being said, understanding that the physical techniques are easy makes it so that a lot of surgeons will say that they know how to do it, it will be on their website, but it's not something that's their focus. So make sure you find that. Otoplasty is a surgery that should typically be done without putting a patient to sleep. If a surgeon does not know that, it's either because they don't do it often enough or they're scared to do it with this patient awake, where they're putzing about trying to figure out what they're doing. This surgery is very comfortably done awake. It's not the surgery that's difficult. It can be the recovery, which depending on your age, the first 1 to 3 days can be fairly painful. Now, when it comes to otoplasty surgery, typically we can do it with a cut or without a cut. In general, as time has gone on, I've preferred to do it with a cut. While you can have candidates who can do it without a cut, when you do the cut, you're guaranteed longer lasting, more sturdy results that are more visualized. And so the traditional otoplasty technique is what I recommend for most people with firm cartilage and the correct anatomy. This video has had a lot of information. Hopefully it gave you the starters on beginning your journey on learning about otoplasty surgery. If you have any questions, leave them below. I'll try my best to answer them. Give this video a like and subscribe to this channel.